Hi, I'm Dr. Nicole Vane, the owner of Moonlight Beach Dental, a general and holistic dental practice. And I want to release a quick video to talk about tooth wear. It's a very complicated issue, and there's many ways to go about treating it. A lot of patients find that they're being told by their dentist that they're grinding their teeth and they're wearing their teeth down. I found this statistic interesting that only 1 millimeter of tooth wear is supposed to occur over 90 years of someone's life. Now, to reference it, we have 1.5 millimeters of enamel on our teeth. So 1 millimeter of wear would still leave us with 0.5 millimeters of enamel over 90 years. I'm seeing patients that are 30 years old, even sometimes 16 years old, with 2 to 3 millimeters of wear where they've actually worn off all of their enamel and they're into the layer of the tooth underneath. That's 270 years of wear when they're only 16 years old or even 40 years old. I'll also commonly hear things like, well, I'm old, or I really like my food, like I've been chewing a lot on these teeth, and that simply won't wear your teeth down. Teeth, when they hit properly, glide off one another. It's called a protective occlusion or a functional occlusion, so that when you tap your teeth together, your back teeth take the load off your front teeth, and when you glide side to side, we're supposed to take the ramps of our teeth are going to glide the back teeth off one another so they're not banging into each other. So either through genetics, the lack of tooth orthodontics, or improper orthodontics, or tooth relapse, any one of these things can lead to improper tooth collisions that result in tooth fracture and wear over time. Now, I have another video on why we have so much crowding to begin with and why that leads to so much enamel loss. But those are some other topics that you can get into if you're interested on our other video series. So for this tooth wear series, I wanted to show you a couple cases and let you know that there's a lot of treatment options out there. But I also want to let you know that even if you don't come to our office, I would hope that the office that you choose goes through a whole series of your bite analysis and photos with you the same day that we would here at Moonlight Beach Dental to help educate you on what's going on in your very own mouth with your bite and why your tooth wear is occurring. So this patient had extreme wear. And what I want to show you is in this case, he wore off all of his enamel. And when we get into looking at some of the photos, you're going to be shocked in that his nerve is actually showing through the front of his tooth. Now, he's in absolutely no pain at all because his tooth wear has been so gradual. The nerve's been shrinking down as frequently as the tooth wear was occurring, and so the body is very protective of itself, so he's not in any pain, but aesthetically now he's gotten to the point where all the edges have gotten so thin they're starting to break. So the first thing we did is to show him the extreme wear on the front and the back side of his teeth, and right now what we're first doing is he had asked me to come in and restore his smile. Now, when I show you the initial pictures, there was a lot of crowding that led to the tooth wear. Right now, we're mid-phase in treatment. We're just about ready to start his veneers, but our whole goal was for me to rotate or pull the teeth back from each other. He had a deep bite and crowding that was causing collision, so I created space and intruded some of the teeth where they were most heavily overlapping in still an aesthetic way, so that now I have the space I need to restore the teeth with porcelain without drilling into the tooth. Now in this case, my only option for doing that, had he wanted to forego the orthodontics, would be to crown every single tooth and open his bite, which is called a full mouth rehabilitation. That's not only very extensive and invasive, but it's also a lot of dentistry. So if teeth are colliding too much with each other, or if they're too heavily worn, we simply don't have the space we need to restore the tooth. And oftentimes, like his case where the nerve is showing through, we don't have the room to drill on his tooth either before we encroach upon the nerve or other vital structures that are much higher than what they would be in a tooth that does not have wear. So for the patient I was just showing you, now that we've looked at his picture up close, you can see on this tooth that was shoved the furthest forward and the furthest back, that little dot there is where he wore off all of his enamel and all of his dentin, and half of it from here and from the front side, and that's where the nerve used to be. So it's a tremendous amount of tooth wear. And then the dentist prior to me had ended up trying to patch all of these areas where the enamel had broken off with bonding, simply with the intention of trying to reprotect the tooth. And as you can see, over time, it's become very unaesthetic. When we go to the roof of the mouth view on this patient, you can really see that all the teeth are heavily worn here on the back side of the teeth, based on how much the lower teeth were scraping against the upper teeth. And that same view, when we go to the lower teeth, you can see from the top down how much collision was going on here. So I'm going to show you another case also where we've actually completed the treatment, which actually had a similar significant amount of tooth wear. Here's another case of tooth wear where our patient was in Invisalign for several months, just to try and again create space for porcelain. Now her teeth were exquisitely sensitive, and the bluing and the graying of all the edges here were because the enamel was so paper thin from all of the wear. Now, when we look at the roof of the mouth view on her and the retracted view, it's really profound. We've gotten the bite aligned, but these teeth had no enamel left. That's her nerve. That's her nerve. And these areas, literally, that hole right there is her nerve. She's worn off all the enamel on all of these surfaces. The porcelain's broken, and on the roof of the mouth side, all of these teeth have enamel that's just sheared off, other than the gold work, which can't break. So what we ended up doing was doing the Invisalign first to create the space, and then the very next step we did, which was the final results. It's just unbelievable. The smile's been restored. We've re-lengthened the teeth to what they looked like before. Actually, probably better than they had before. Her smile's been restored. And you can see that now the teeth not only guide off one another, but they're very aesthetic. They're much whiter, they're longer, and we've given her a much fuller smile that makes her look like she's had a lot more done than just dentistry. So again, really be mindful of tooth wear and things that you may notice with chipping and wearing of the edges, or when your bite begins to collapse. Feel free to ask me any questions you have about tooth wear that you're noticing, and certainly expect that that'll be a conversation that we do on your thorough exam when you're here as a new patient, or when you're here for any of your checkup or recare visits. We'll be reviewing with you the wear on your teeth. Also, this computer allows us to scan you again if you weren't quite possibly a believer, you didn't really think that this wear was going on. Some people will say, oh, I used to bite my nails as a kid, or I used to grind a long time ago and I don't now. This computer will actually store all of your data in the cloud and superimpose it. So if I scan you now and 6 months from now and 6 months after that, it'll actually superimpose the data and show me exactly how much wear has occurred on each cusp, tip, and point over the course of time. I really find that to be a useful and educational tool. So again, feel free to ask me any questions you may have when you're here for your visit, and I hope you found this video informative.